Hi everyone and welcome to my channel. If you're new here, my name is Antoinette. I'm a registered nurse, and about a year ago I shared a video about my personal experience with SVT, Supraventricular Tachycardia. In that video I talked about what SVT is, what my episodes felt like, and how I ended up in the ER needing adenosine to stop the episode. I also talked about some techniques and ways to stop an SVT attack. Just a quick, brief overview. SVT is a heart rhythm issue. It's regarding the electrical current and signal of the heart, and the issue starts suddenly, and it's a very fast heartbeat. It's due to an abnormal electrical current. Episodes can come on abruptly and cause symptoms like palpitations, dizziness, shortness of breath, chest discomfort, or anxiety. For many people, it's not dangerous, but it can be very uncomfortable and scary when it happens. It's been almost a year since I made that video, and I wanted to come back with an update, both medically and personally, because I know how helpful it can be to hear about how it plays out in the long term for people. Since my last video, I went and saw 2 electrophysiologists. Electrophysiologists are a type of cardiologist that specialize in the electrical current of the heart. The first one that I saw recommended a pill in the pocket technique. The medication that he gave me is called Cardizem. It is a calcium channel blocker, and it helps slow the heartbeat down. It can take a little time to work, but just having that pill in your pocket can be comforting if you're concerned about an SVT episode. The second electrophysiologist discussed a cardiac ablation, but emphasized that it's a very personal decision and something to consider only if I'm ready and if the potential benefits outweigh the risk for me. That really resonated with me because SVT management is not one size fits all, and everybody has their own experience and what's best for them. So over the past 11 months, I've actually had 1 episode of SVT that was significant. I was able to stop that episode without any medication using the ice water technique. I did discuss this briefly in my last video. What you'll do is you'll fill up a bowl of water with ice and then submerge your face for about 15 seconds or so, holding your breath. This activates the vagus nerve, and it can help slow down the heartbeat. This worked for me very quickly. Probably after the first time I submerged my face, within 15 to 30 seconds, I was out of SVT. Afterwards, you do feel a little uneasy and a little shaky for a little while, but my heart rate was back in a normal sinus rhythm. It was a little elevated still, but it was well under 100. I've also had a few brief episodes of PVCs and PACs. These are premature heartbeats. PVCs can come from the ventricles, which are the lower chambers of the heart, and PACs come from the atria. They can feel like a flutter or a skipped beat or a thump in your chest. In my case, they're usually short-lived and they go away on their own, and they have not triggered an SVT episode, although sometimes they can. The distinction is important because not everyone with abnormal heartbeat has SVT, and learning that helped reduce some of my anxiety around this. So mentally and emotionally, I've had some impact regarding the SVT episodes because I've had some fear. Even though my episodes have been minimal and I was able to get out of that episode on my own the last time, I have had some fear around traveling, particularly traveling on an airplane. I haven't done so in a year, and it does promote some anxiety thinking about if I did get an episode that I couldn't abort without a medication like adenosine, which obviously wouldn't be available on an airplane. So the fear is something that I do have to consider regarding my treatment decision. So where I am now. So since I've had 1 episode, and it hasn't been that frequent in the past year, I've decided to continue to monitor my symptoms, stay aware of my potential triggers, which I really haven't found that many potential triggers. Some hormonal triggers I've noticed. Certain points in my menstrual cycle seem to trigger more skipped beats or abnormalities with my heart rate. But I've had many people comment, which has been helpful on my last video, about how the ablation has been life-changing for them. That has been great. It's wonderful to hear, and I truly appreciate those experiences. Hearing real world outcomes has helped me stay open to the future of potentially getting a cardiac ablation. Right now, I'm choosing to balance my symptom frequency with quality of life and peace of mind. And so that might look differently for somebody else, but currently that's what I've decided to do. So if you guys could let me know, have you had SVT? How have you handled it? How often do your episodes occur? What are some interventions you do? Did you choose an ablation? Did you choose medication? And how has that worked for you? And has SVT affected your confidence with travel, exercise, or just your daily life in general? If there's one thing I've learned this year is that SVT isn't just about the heart rhythm, it's about learning to trust your body again. Thanks for being here, and I hope you found this video helpful. If you have, please like it, comment, or share it with somebody you know. Thank you.